So the XTOSI study is the first in-man clinical trial looking at the efficacy and safety of the Magic Touch sirolimus coated balloon on patients with peripheral arterial disease. So it's an all-inclusive trial looking at both SFA and below-the-knee arteries in the legs. Well, this was a study looking at primarily a critical limb ischemia cohort of patients, which means that in terms of the Rutherford scores, more than 90% of our patients had Rutherford scores of 5 or 6, which means these patients have got wounds on their legs. We recruited 50 patients in total over a period of 12 months. We now have access to the interim analysis for about 40 of these patients. The full data will be out in April next year. We recently completed our own Singapore randomized control trial on BTK. This was performed by another group of investigators looking at a paclitaxel drug-coated balloon. And according to their data, the 6 months primary patency for paclitaxel drug-coated balloon for BTK was 40%. So the XTOSI BTK 6 months primary patency of 74% is highly promising. In terms of the safety data, we defined it as a composite of absence of 30-day mortality, absence of 30-day limb amputation, and also absence of 6 months target lesion revascularization. And that was also highly promising at about 85%. So the first challenge with this cohort of patients was the fitness and the fact that they were high-risk patients. Because it was a critical limb ischemia cohort of patients, 90% of these patients had diabetes. And when assessed by the anesthetist separately and independently, 80% of them had ASA scores of 3 and above. So they were highly unfit patients. The second problem was the complexity of the lesion itself. The majority of the lesions were below the knee. And we tested the Magic Touch sirolimus coated balloon on BTK arteries in the majority of times, 60% of the time. And the lesions were long. The length of the balloon used for SFA was about 270 millimeters. And the total length of the balloon used for BTK was about 190 millimeters. And when we classified them according to the Wi-Fi score, again, that showed that the majority of patients had high Wi-Fi scores of 4 and above. So this is just a first-in-man study. It is a proof of concept on the sirolimus-coated balloon. And the next step is that we need level 1 data on a larger population of patients. So we are about to enroll our first patients into our randomized control trials. There will be 2 of them, which will be performed in Asia, involving 3 countries: Singapore, South Korea, and also Taiwan for the time being. These randomized control trials are called FUTURE-SFA and FUTURE-BTK. These are 2 separate trials. One will look at the SFA, the other will be looking at below the knee. Given the recent controversies regarding the use of paclitaxel drug-coated balloons, sirolimus-coated balloon offers potentially highly effective option, and is also potentially safer. And so this will represent a key improvement in terms of our ability to save patients' legs in a population of critical limb ischemia.